Welcome back now. Time now is 9:12, and we are in the studio with Dr. Mark Mandell-Brown of the Mandell-Brown Plastic Surgery Center this morning, and we're talking about the top trends when it comes to cosmetic procedures and plastic surgery. Thank you for joining us.
Well, thank you.
Okay, so we were just talking about some of the more popular procedures that are going on right now. So tell me this. You said that everyone right now is really looking for those non-invasive procedures.
Non-invasive, by far, are number one in Botox, soft tissue fillers, things that people can feel good about themselves and get right back to work. But there's still non-surgical options like cool sculpting and hot sculpting that will melt fat, tighten skin. And these procedures, there's no downtime whatsoever.
No, that's one of the things a lot of people ask. I've seen so much about cool sculpting. A lot of people want to know, well, does it work? Like, how effective is it? I mean, what exactly does it do?
Well, cool sculpting works by freezing the skin and freezing the fat. There's another modality, which we have called hot sculpting, which heats the skin and heats the fat. So I always ask patients, would they rather be in Antarctica or would they rather be in Jamaica? And so, but all these will improve 10 to 30% at most. And so what we find is some people still need surgery.
Okay, so when you talk about just the downtime, a lot of people avoid getting surgery sometimes because they're afraid that they have to be out of work for weeks. But it's changed.
It has changed. And what we're finding is that we can get breast augmentations back to work in 2 or 3 days, tummy tuck or mommy makeover patients back to activities in about a week. There are a lot of different things that we're doing, such as PRP, platelet-rich plasma. In California, they call it the vampire tummy tuck or the vampire facelift. But we use our own cells to stimulate their healing.
So tell me this, when you have a person who wants to come in and they want to get something done, you know, what's the process as far as like maybe cool sculpting, or if they do want to come in and get Botox, what are some of the questions that they need to ask themselves before they show up to your office?
Well, I think the first thing is going to a qualified center.
Yes.
And I think somebody that offers several modalities, I always say if you have one hammer, that's the hammer you're going to use. I think you need to have different tools in the toolbox. And so having hot sculpting or cool sculpting, Botox fillers, and surgery.
Okay, so, and you said that, just speaking of that, going to someone who is qualified for this, you know, there are a lot of places that offer cool sculpting, or, you know, that offer what I'm now hearing about is laser lipo, and, you know, so, but they want you to have so many different, I guess, sessions. You know, when it comes to that procedure, you know, is that something that you need to do, several different sessions, in order for it to be effective?
Well, it can be. Some, like we have something called True Sculpt, which is really one session. But you have to be careful because you can spend a lot of money in this field and not get any benefit. So I think getting the right procedure to match what you need is important.
So how do you know the difference between going to cool sculpting and then just saying you just need surgery?
Well, I think that it's something that in the consultation, the doctor and the provider and the patient have to really discuss, and it is based on what the patient's budget is, what their goals are, and what their downtime is that they can experience.
Okay, so if speaking of consultations, if people are watching this right now and they say, look, I want to come in and I may want to get a mommy makeover, or I want to do cool sculpting, or want to try Botox, how would they get in touch with you?
Well, they can call our office, 513-984-4700, or just email us at mandellbrown.com.
All right, thank you so much for joining us this morning.
Okay.